Hello and welcome to this video tutorial hosted by wellmedic.co.uk. We help make GP training easy. Now this is an updated version of an old video that we used to host on YouTube, which is all about making clinical case reviews easy and how to complete a clinical case review. Now this video forms kind of two purposes. The first purpose is it's now part of our GP trainee portfolio support package, which is a package which helps GP trainees with the most difficult parts of the portfolio, which we now run on wellmedic.co.uk. And secondly, it goes across our blog guide, which is all about how to complete a clinical case review. So do check that out. Just head over to wellmedic.co.uk. And of course, we're also hosting this on YouTube so that you guys get a reasonable understanding of how you can run through a clinical case review on the portfolio. So firstly, what we'll do is we will go through kind of the basics of a clinical case review, and then we will also run through how to reflect and also how to link capabilities. So the first thing that you need to do when you do a clinical case review like this is you need to pop a title in. So generally speaking, the title needs to be brief. It's purely there to remind you of the event, and in certain circumstances you may want to do something that is more specific so that it is easier for your educational supervisor, but also easier for the ARCP panel to locate a particular blog. So for example, let's say that you're doing an out of hours session, then it's quite helpful to just write out of hours session next to it. Additionally, let's say it's a safeguarding reflection, I would also then put it into a bracket and say safeguarding reflection. So for the title for this one, we've started with ectopic pregnancy, and this was an ED case review. Then we move on to the date. So when you're putting in a date, again, it doesn't make a huge difference in terms of what dates you put down, but generally speaking, what you don't want to do is do all of your clinical case reviews or reflections over a single weekend. So just make sure that they are staggered out. And if it's something that happened a couple of months ago, then you can retrospectively backdate the reflection as well. And then you've got your setting. So in terms of your settings, these are things like out of hours, hospital, GP, and so on. So this clinical case review that we're going to cover today is within the hospital. So we're now going to work through some of the juicy parts of completing a clinical case review. So in order to help with this, I'm actually going to use an earlier example that we've done within our blogs, which is around an example of an ectopic pregnancy case, which has been taken from my guide on reflecting within the WellMedic blog. So the first thing we do is we stick with a brief description. Now, when you have a description, keep it very, very brief. Okay, try to avoid jargon, as all you're trying to do here is give the entry some degree of clinical context. If you write too much, it's only going to take you longer to write, and it's going to take your supervisor longer to read, and ultimately that's not an ideal situation for either you or your supervisor. So the brief description here is that you've reviewed a generally fit and well 18-year-old patient during an A&E shift, presented with a 11-day history of fever, lower abdominal pain. You're worried about appendicitis, but the patient's had a positive pregnancy test and then gone on to have a scan which has confirmed an ectopic pregnancy. So the second thing we're going to cover within your clinical case reviews is your clinical experience groups. So clinical experience groups are your mandatory areas that you need to show coverage over, and you can see this on your portfolio homepage. And from this we have gone with gender and reproductive health, which it fits into nicely, and because it fits into urgent and unscheduled care, I've also selected that as well. Now some of your cases may not fall into any clinical experience groups, others may follow into more than one, and generally there's a maximum of 2 experience groups that you can select. Okay, so the next section that you actually see within your form on the 14Fish platform is going to be the capability area. Now, what we're going to do is we're going to just skip that for a second, Okay, and we're going to focus on reflection and learning needs. Now, we go through capabilities in a huge amount of detail within our course, and actually the majority of our portfolio support package is around how to link capabilities properly so that you're not needing to duplicate your workload when it comes to your educational supervisory review. And we have something like 78 clinical case review examples across all 13 capabilities that you can have a look at it. So what we're going to do is let's go down all the way down to the last part, which is reflection and learning needs. Okay, so this is an area where trainees do struggle in terms of what's the right way to reflect. Is there a wrong way to reflect? But ideally speaking, when you get to the reflection area, you just really want to focus on kind of 1 to 2 points within this scenario. So I personally use the Gibbs reflective cycle as a rough guide, which covers the following points. What are my feelings? What are the positive and negatives of the situation? Would I do something differently? And is there a doctor's educational need that I can take from this case? So here's an example of what a reflection should look like. So you can have a read of this yourself and pause it, but I'll just quickly kind of go through it. So during my initial review of the patient, didn't consider that an ectopic pregnancy was within my differential diagnosis. I had some tunnel vision with diagnostic thinking. I felt that the fever, diarrhea, prolonged history of abdominal pain was more in keeping with appendicitis, and that one of the advantages of working with A&E is that the patient's urine is often dipped for you, and a pregnancy test is often performed. And actually, one of the learning points that I take away from this is considering the chances of pregnancy in patients of childbearing age, and also about how it can be difficult to involve 2 clinical teams. Okay, so again, the key thing here is kind of almost considering the clinical case review to be a pyramid. So at the top of the pyramid, you've got your brief description, and at the top of the pyramid, you've got the brief description, and at the bottom of the pyramid, you've got the bulk of the reflection, the bulk of this clinical case review. And the bulk of this process should be around reflecting back on how you felt, how did it make you feel, what could you do differently, what were some of the advantages and disadvantages of this scenario. So that's always what you're needing to think about when you're filling out these forms. Unfortunately, what tends to happen is when you're a new trainee, you tend to do it the other way around, almost like an inverted pyramid, where the brief description is really, really big and then the reflection is really, really small. So just focus on just giving context at the top and then work your way to the bottom and reflect on how that scenario went. And then finally, once you've reflected, you then go on to your learning needs. So learning needs identified from this event. Now, I must confess that not every case will have a learning need, but it is helpful if you can find a learning need. So here are again examples of what I identified from this scenario. Of course, this is not a real scenario. It is kind of made up, but really what I'm trying to do is highlight kind of points that you will encounter within your own training. So one of the things here is, this is a secondary care scenario. How would I actually do or manage a scenario like this in primary care? So again, that's maybe not a kind of tangible goal in the sense that it's not easy to demonstrate progress on that basis. Okay, but it's reasonable. What's better is if you can be specific about what the learning need is and how you're going to achieve that learning need. So now you can see here, in terms of the more realistic goal, is around what's called a doctor's educational need. So if you've had a read through our reflection guide, you will see that I cover PONs and DENs in more detail. So a DEN is a doctor's educational need, and ultimately that's what this learning needs identified is focusing on. So although the first point is acceptable, the second point is better, which is, you feel that you need to increase your knowledge around the differential diagnosis for appendicitis. And actually there is a differential diagnosis section within the CKS for appendicitis, and that would be something that you can read and that you can reflect on, and then you can document that within the CPD area of the portfolio. So again, what that does is it helps you complete a learning cycle. So you've done a clinical case review where you've identified a learning lead, and then what you can do is then you can go on back onto the portfolio, click onto the CPD and supporting documentation area, and then what you can do here is you can then reflect on the guideline that you've read on appendicitis, and kind of how you now feel after having covered the NICE guideline. So again, it's about completing the reflection cycle rather than just doing lots and lots of reflections without actually thinking about what you are going to gain in there in order to show progress as a GP trainee. So now that we've covered the bulk of reflection, we're now going to move on and talk about capabilities. So capabilities are arguably the most important section within the portfolio, and the really important thing about capabilities that you have to remember is that if you prepare for capabilities properly, then actually it's going to make a lot of the portfolio very, very straightforward. And the reason why you have to do this is that every 6 months you're going to have either an interim educational supervisor review or an educational supervisor review, and the RCGP mandates that you should have pieces of evidence to demonstrate that you've met these curriculum capabilities. And again, we go through this within a lot more detail within our portfolio support package, but also within our blogs as well. So when you're preparing for your reflections, you need to be strategic in terms of what you're reflecting on. So let's say you've highlighted your communication skills 10, 15, 20 times. There's no point repeatedly doing clinical case reviews that only highlight your communication skills. Let's say that you've not done enough in the way of fitness to practice. Then what you can do is you can have a look at what we call the clinical descriptors for each capability, and think about whether you have a case that you've encountered within your practice that would be better suited to fitness to practice, and therefore you can be more strategic in terms of how you're completing these clinical case reviews. So let's go back to our entry here, and we're now going to focus on these capabilities. So although I can't do it on this form here, once you've selected a capability within your form, you will have a small thing at the bottom of that capability which would say show word descriptor. Now if you click onto show word descriptor, what it does is it brings you up with a table of examples of what demonstrates competence within this capability. And again, this is covered within our lessons for the GP support package. Now there are several columns, but the columns that you need to focus on are the 2 columns that demonstrate competent and excellent. Okay. Now, the reason why this is important is that when you do your ESR, at the end of the ESR, so at the end of your placement, you will then be looking at providing justifications within your educational supervisor review to say that you have demonstrated this capability, and you would have to then collect and reflect on at least 1 to 3 cases where you've done that. So if you prepare for that now by writing your justifications for capabilities properly, the ESR becomes really easy because you've already put in the hard work and you're not needing to duplicate that work. So here is a capability that I've selected from here. So the capability that I've selected is working with colleagues and in teams. And then what I will do is I will select one of the statements from the detailed descriptors. So for this first one, the detailed descriptor that I've selected is about proactively communicating with team members. Okay, and I will directly copy and paste that, and then I will adjust the statement to fit that detailed descriptor. So if you can see here, I say I have demonstrated this capability as I have communicated proactively with team members to enhance patient care and using an appropriate mode of communication for the circumstances. Okay, so as you can see, as I've put this in as an extra, as you can see, I've adjusted that statement ever so slightly, and then I followed up with this statement here. So the statement that I followed up with is this: during this case, I have specifically coordinated patient care by speaking with the surgical and gynecology doctors. During my verbal handover, we were able to synchronize the patient's care under a shared care agreement. So that shows how I worked with my colleagues from the gynecology team, but also my colleagues from the surgical team within this reflection. Okay. Now, if we move on to the second capability, which is around organization and management, then again, I will click onto organization, management and leadership. I will click onto detailed descriptors. And then what I will do is I will select a statement. So for this capability, the statement that I selected was, I will choose the statement of being organized and demonstrating skills in time management, handover skills, prioritization and delegation. So the way I then write the statement is I adjust that to show why this was the case in this scenario. So I've demonstrated this capability as I am well organized with due consideration for colleagues and patients. I have shown effective time management, handover skills, prioritization, delegation in this case. Now, my further justification then becomes that this case occurred during a busy A&E shift, and I was concurrently seeing 3 patients waiting for outstanding investigations. The cases were not urgent, and I knew that I had to balance my time across them. I prioritized the most acute case, handed one issue to my colleague, and apologized to the other patient for the delay. So here you can see that as long as you use the detailed descriptors, it then becomes very easy to justify your capability. And all that happens is when we come to our ESR, and again, within our support package, there is a video demonstrating how to do this for your ESR. When you're doing your ESR, all you want to do is choose the case that's been linked. What 14Fish will do, it'll copy and paste these statements into your justification box, which is called the evidence of why you're using that justification. And then all you need to do is slightly adjust the paragraph to say, I have demonstrated capability in working with colleagues and in teams. I demonstrated it during this case, titled Ectopic Pregnancy in an A&E Shift, and then just copy and paste this box below it. And therefore, when your educational supervisor is having a look through your portfolio for that supervisor review, they're able to see that actually, this trainee has demonstrated competence in this area, and then they will rate it, you will rate it, and hopefully it'll all be finalized, and then you'll move on to your next 6 months of training. So I hope you found this helpful. Again, it is a whistle-stop tour on how to complete a clinical case review. There's lots of more information within our GP support package. You can also check out our blog on wellmedic.co.uk. And if you do have any questions about the portfolio, you can always drop us an email at sham@wellmedic.co.uk.